About 3 years ago, almost 3 years ago, I was diagnosed with a neurological condition.
Well, I was lying on the beach in the Cayman Islands, soaking up the sun, and all of a sudden the side of my mouth dropped.
If you're having a TIA or a stroke, you don't know which one it's going to be. So if you're having any kind of symptoms, get to the hospital right away and get treated. If it's a stroke, we need you at the hospital as quickly as possible so we can give you treatment quickly and fix it.
And I sought treatment.
So I ended up in the hospital.
So patients really with neurological problems, we get most of the information from listening to them and hearing their symptoms. It's not a specialty where we can just do a simple quick test. So it's really important just to listen to the patient, ask them questions, and they tell us what's wrong with them, but they have to be given the opportunity to do that.
So I came down to Dr. Holland, and he was so knowledgeable and open-minded that we tried another treatment, and my improvement was unbelievable, dramatic.
Well, Dr. Holland, of course, has been my neurologist since 2004. I've never gone to anyone else. I haven't felt the need to go to anyone else. And he has been my physician, my personal physician.
So I've been a neurologist at Monmouth Medical Center for more than 10 years now. And for the last 2 years, I've been Chief of Neurology and Medical Director of the Neuroscience Institute. And in that role, I'm really trying to use all the different talents and facilities we have at the hospital to bring them together into cohesive programs.
And he's also a generous professional, so that he has medical students coming in, and he shares his expertise and wisdom in a way that doesn't make the patient feel disrespected.
The goal here is really to prevent stroke. So stroke is preventable, it's easily preventable, it's just spreading the word to people and identifying the risk factors and treating patients appropriately to prevent strokes. So the TIA Center is something really innovative. So we've been dealing with stroke at the hospital, and we have a stroke program to deal with acute strokes, but we're really looking now to move into the prevention field. And we've identified patients who've had a TIA or a minor stroke as being really high risk for having a future major disabling stroke. And with this program, we're trying to focus on these patients and really identify their risk factors and fix them very quickly, so we can, rather than treat stroke, we can prevent stroke.
I really admire Dr. Holland. He's brilliant and he's very humble, and he's enormously compassionate.
Well, I see stroke as a major cause of disability. So that's really why I'm focusing on stroke prevention, to try and prevent disability.
I drive an hour and a half to see Dr. Holland, and he's that good. And if he was 3 hours away, I would say gas up the car. So,
well, of course, he's a brilliant man. I love his British accent, and he has a great sense of humor.
Stroke and TIA Center wouldn't have been possible without the cooperation of a whole bunch of other people at Monmouth Medical Center. So we have great support from administration. We have great support from all the other disciplines. Patients need to get MRI scans and tests done quickly. We have a lot of cooperation from the radiologists. They need to get their hearts looked at. The cardiologists are involved. We have a great nurse practitioner. Even the people who schedule the appointments and coordinate the appointments are important. And we couldn't have a TIA Center without all those people. At Monmouth Medical Center, I've had a lot of inspiration and help from the chairman of medicine, Dr. Alan Tunkel, who's really been very supportive and has really helped us get this center going. And there's one administrator in particular, Shirley Wang, who's an assistant vice president who's been working with the Neuroscience Center and has really been instrumental in helping me set up a lot of the programs. Obviously, being a physician and especially having leadership responsibilities, it takes up a lot of time, and it takes up a lot of family time. So thankfully, my family are understanding and very supportive of that.
I'd really like to thank Dr. Holland for making such a difference in my life. And Dr. Holland, you're making a tremendous difference in the lives of patients, professionals, and community members, and I'm very, very grateful.
You know, I would like to thank him for his upbeat attitude. He's just wonderful. He's very much in demand, and I just feel so fortunate to have him.
Receiving this award is obviously a huge honor, and it's a wonderful thing, but I want to make the point that this is not about me. Our program is a multidisciplinary program with lots of other people involved. Hospital administrators, radiologists, cardiologists, even the people who make the appointments and make sure patients get to where they need to be. And it's important to recognize that this honor is extended to all of those people, not just to me.
Congratulations, Dr. Holland. on your award from the American Heart Association and the American Stroke Association. Keep up the good work. We love you.